Stress echocardiography, often done by giving a dobutamine infusion in graded doses, assesses regional wall motion abnormality for indicating critical epicardial coronary artery stenosis that mostly determines subendocardial underperfusion. Recent introduction of evaluation of left ventricular contractile reserve based on force has enriched the core protocol of stress echocardiography. Left ventricular contractile reserve is the difference between the basal and peak stress. Stress could be either exercise or pharmacological. Left ventricular ejection fraction. It unmasks latent left ventricular dysfunction that may not be visible while the patient is at rest. But left ventricular ejection fraction is dependent on preload and afterload, that is related to ventricular volume and blood pressure. The newer, more robust echocardiographic marker is force-based left ventricular contractile reserve. Force equal to systolic blood pressure divided by end-systolic volume. Left ventricular contractile reserve will be force at stress divided by force at rest. The ratio is relatively load independent, making it a truer measure of the health of left ventricular muscle. Systolic blood pressure can be determined by a sphygmomanometer and end-systolic volume by echocardiography. Changes in force can be caused by microvascular and/or epicardial coronary artery disease. It can also be affected by myocardial scar, necrosis, or disease of the subepicardial layer. Normal value is typically more than 2.0 for exercise or dobutamine stress echocardiography, or more than 1.1 for vasodilators. Lower value for vasodilator is because that is a weaker inotropic stimulus. Vasodilator stress is often used during nuclear myocardial perfusion imaging like SPECT. International Stress Echo 2020 study evaluated the prognostic value of left ventricular contractile reserve both in ischemic and non-ischemic heart disease. The study used ABCDE protocol for coronary artery disease. Step A, regional wall motion abnormalities on stress echo. Step B, B lines on lung ultrasound.